Everyone has a calling in life, whether it's a teacher, police officer, firefighter, dentist, doctor, or nurse. And beyond those callings, there is a reason or story behind why they chose it. I can remember it like it was yesterday. Ever since I was 4 years old, I would lie on my grandpa's stomach and watch the real ER with him. You think, being the little innocent 4-year-old that I was, that my eyes wouldn't be able to handle the grotesque scenes. But in actuality, I couldn't keep my eyes off the screen. That was just the beginning of my interest in all things medical. It was sad and ironic that my grandpa would continue to be at the center of my interest in medicine. For the past 14 years, my grandfather, who lived across the street from me most of my life, has had some form of cancer or another. He has had surgeries, chemo, and radiation, and most recently a permanent colostomy. When my siblings and even my mom were scared or grossed out, I remained interested. I had no problem being in the room watching the nurses care for my grandpa. In fact, it was the nurses who helped my grandpa more than anyone. He called them angels on earth. I had always had an interest in medicine, and after watching everything my grandpa went through, and how he was so thankful for all the nurses, I knew that I had found my calling. Throughout my life, I have demonstrated many skills that are parallel with those essential to nursing. I have shown leadership skills, for example, when I was captain of my high school soccer team. I have also demonstrated hard work and perseverance. I worked diligently for my acceptance letter into the Indiana University Nursing School. In the past several months, I have accumulated a multitude of information that will shape my identity not only as a nurse, but also as a human being. I have learned that the role of a nurse is more than just taking vital signs and doing a head-to-toe assessment. Caring for patients requires that nurses take on different roles at different times. My role as a nurse includes being a caregiver, teacher, leader, team member, communicator, and client advocate. As a care provider, I will do everything I can to provide patient-centered care, which is providing care that is respectful of and responsive to individual patient preferences, needs, and values, and ensuring that patient values guide all clinical decisions. In addition to being my patient's care provider, I will also be my patient's advocate in every situation. I will be assertive and speak up if I believe my patient's safety and health needs are not being taken into consideration by those who are involved in their care. As a nurse, it is also my role to be a teacher. I will properly educate my patient and their families on the patient's care plans, making sure they are well aware and competent on their treatment plans. Nursing is a profession that operates on the framework of teamwork. Throughout my career, I will need to work and communicate with physicians, technicians, and families. The group projects and simulations I have already partaken in nursing school have given me the opportunity to practice teamwork skills that I can eventually apply later in my future fieldwork. In addition to the roles I have previously mentioned, it is my job to be a mediator. Hospital nurses experience workplace conflict among colleagues, professionals, and patients and their families. It is my job to intervene and resolve these conflicts. Nursing is a high-stress profession. Because of this, I need to make sure I can take care of myself in addition to my patients. In order to do this, I will eat healthy, exercise regularly, and get plenty of sleep. By upholding my values as a nurse by taking care of my patients and myself, I will be an example to those around me in the workplace. The key responsibility I have found to be most important in our role as a nurse is effective communication. Professional communication is a twofold necessity in this career. I will keep a calm attitude, although many tense situations occur throughout the day in the hospital. It is crucial that I remain calm. When unprofessional communication is taking place, I need to make it my duty to stop it. These practices begin with being assertive while expressing concern in scenario. Oftentimes, when communication is the hardest to perform, it is the most important. Advocating and caring for our patient is one of our main roles as a nurse, and requires effective communication skills in order to do so. In order to advocate for our patient, we must listen to them. Active listening is a key aspect of good communication. Without listening to what someone has to say, communication can be difficult and oftentimes ineffective. Good communication skills can make the difference between a good nurse and a great nurse. In connection with my future practice, I will continue to develop my identity as a nurse. The medical field is always changing. I need to continue to educate myself using current, evidence-based practice to provide the most up-to-date and favored procedures for my patient. I also need to educate myself in order to be competent in recognizing and understanding cultural differences. Nursing is not just a job where you work 40 hours a week and clock out at the end of the week and receive a paycheck. It's a way of life, which will become part of my character. I cannot say with absolute certainty where I may end up on this adventure of life. I may be a pediatric nurse in Chicago, a nurse anesthetist in North Carolina, or even a critical care nurse in Michigan. But I can say with complete confidence that wherever I end up, I will provide the utmost care to my patients in a caring and professional manner. Overall, I look forward to continuing on my nursing journey, carrying the skills I have attained throughout this course, and learning how to be the best nurse I can possibly be. I don't expect to be a perfect nurse when I graduate college, but I hope that with the use of my textbooks, class lectures, clinical times, and the experiences I encounter, I can learn something new every day and can hopefully get there one day.